This is The Referral with me, Dr. Karan. Now, if you're interested in medicine or science or are just interested in improving your own health, you're in the right place. Every week, we're going to be debunking myths, having expert insights from guests, and also giving you science-based strategies to make you healthier and hopefully happier and feed your curiosity. In this week's episode, we're talking about autism. Autism is a lifelong neurodevelopmental condition which affects how people interact and communicate with the world. Current estimates suggest that more than 1 in 100 people are on the autism spectrum. So there are millions and millions of people who are either autistic or who have autism spectrum disorder. People who have autism or who have autism spectrum disorder are known as neurodivergents. They literally have a brain that is different in structure and anatomy. If you know someone with autism, you may have noticed that they can learn, behave, communicate, and even interact with the world completely differently to other people. And as I mentioned, autism is on a spectrum, so some people can require a lot of help and specialist care, and some people you may not be able to tell the difference between someone with autism and without autism. For the first time on this podcast, I'm joined by not one, but two guests, David and Carrie Grant. They have 3 children of their own, all of whom have been diagnosed with autism. Now, both of these guys are BAFTA award-winning broadcasters. You may have heard them or seen them in the hit show Pop Idol, where they're well-known vocal coaches.
You are considered less than, so you have to be better than to be perceived as equal to. Please don't tell me you're neurodivergent as well.
The onus is on the person to change, when actually it's the world that needs to change.
So I grew up listening to respond. With the kids that we have, I've had to learn to listen to understand.
And a bit later, I'll be answering your questions using all the knowledge and experience I've gained working as a doctor in the NHS for over 10 years. Now, if you've got your own burning question you want in this show, feel free to get in touch at thereferralpod.com. And if you're not satisfied with that and you want even more deep dives into your interesting questions and to feed your curiosity, you can subscribe to The Referral Plus on Apple Podcasts. David and Carrie Grant. So I've already introduced you, but tell me and tell our listeners and viewers a little bit about yourselves.
My name is David Grant. I've been in the entertainment business for 4-5 decades now, starting off first as a singer, then a songwriter, then vocal arranger, producer, vocal coach, then talent show judge, presenter. And most recently, Carrie and I have been advocating for our children, and our children are children with special needs. And that's become sort of the driving focus of our lives.
Yeah, so I've done pretty much the same career as David. He's had a few more hits than I've had by a long shot. But my passion has been about advocacy in health education and social care. So I've been working in that field for about 2 decades, or actually 3 decades now.
Wow.
Yeah, something I really, really care about.
And you're both very busy people with so many different things going on in your life, various projects, but you've also got 3 children who have autism. Tell me how that is being parents and living your lives with this every day.
Yeah. Well, we've got a neurospicy family. We've got 4.
Neurospicy.
Yeah, neurospicy.
Very
We're all neurospicy. So we have 4 children, 3 birth, 1 adopted. As you said, 3 have autism or ADHD, and all the disses, the dyslexia, dyscalculia, dyspraxia. Yeah,
yes.
Lots of disses. And then our youngest, our adopted son, he has a thing called DMDD, which is disruptive mood dysregulation disorder, along with ADHD. So there's a lot in there. And I suppose, in answer to your question, what is this like day to day? Well, I suppose when we started with our family, our oldest is 28, it goes 28, 21, 17 and 13. So big spread. I think you set out on your parent journey thinking, right, this is how parenting's going to be. And David and I had very clear ideas about that. And then we found out that wasn't to be the case. And so we had to shapeshift into being the parents that we needed to be for our children, which means 4 different ways of parenting, actually.
Yeah.
There's a lot of overlap, but there's also being, each child's specific needs need to be met. Also, our children are mixed race. Also, our children, 3 of them are trans and or non-binary. And so there's there's a lot of intersections happening that we have to be able to respond to in ways that are helpful to our children.
So, I mean, you mentioned 3 of your children, have autism, and obviously the autism is a spectrum from mild to severe. And actually, I guess a lot of people can easily paint someone with autism as, okay, you've got these fixed features, but, everyone's an individual and we're all wired in slightly different ways. Even, autistic people have their own, idiosyncrasies, as it were. Do you find that there are significant variances in those 3 children as well, in terms of how different they are in how they manifest their, characteristics with autism?
Such a good question, because that is exactly what we find. There's an old saying: if you've met an autistic person, you've met an autistic person. You've met one autistic person. That's all you've met. One autistic person. Our 3 children, the way that their autism presents is entirely different. Also, the things that they're anxious about are entirely different. The way that they interface with the world is entirely different. And I think there's a uniqueness to autism that people will look at somebody and say, oh, that person is like that because they're autistic, or that person is autistic and therefore they're not going to be able to do this, that, and the other. For instance, when our second child was in school, we would say to members of the primary school that they have an autism diagnosis, and we'd be told, well, the diagnosis is wrong because they make eye contact. And if they're autistic, they couldn't make eye contact. Whilst it's true some people on the spectrum don't make eye contact, others do.
Yeah.
And we have this horrible thing, this word called high functioning, which kind of suggests that there is a bottom scale, which is really awful.
There are gradients,
and then it really is about being neurotypical passing, normal passing, and that's not helpful.
Probably a lot of the blame for society's view that there's high functioning is probably from these films like Rain Man, where you've got someone who's autistic savant, and they focus more on the savant, that, okay, so, people with autism or autistic people are geniuses. And that leads in terms of, we then, because of those Hollywood films, we neglect the fact that actually, some autistic people can have significant detriments and a worsened quality of life because of some, cognitive issues they have and severe social awkwardness and communication issues. And we, think, okay, they're geniuses. They can deal with life. And it's only 10% of people, roughly, who are autistic may have those, expert level, skills.
Yes. Well, you've got to remember that sometimes those expert levels of skills come from the fact that our children have intense interests.
Yes, focus
so if someone has spent 12 hours a day thinking about something and a neurotypical person hasn't,
like delving into
the chances are they will become expert at that thing.
When did you first pick up any signs or hints that these 3 children had autism? Was it very early on? And what were the things that you noticed which led you down that path?
Gosh, in our book, A Very Modern Family, which has just recently come out about autism, about our family, about neurodivergence, about raising children with mental health sort of challenges and neurological challenges, we start by talking about a journey on a plane, about getting into an airport and being on the interconnecting train between disembarking and collecting our luggage, and our child hearing the intercom, our now 17, who was 2 at the time, and screaming at the sound, because what we didn't realize is that their presentation of autism means that their hearing is like supersized.
They have hypersensitivity.
Hypersensitivity. I mean, if we whisper in another room and Arlo can hear us, it's just incredible. But we didn't know this at the time, just a massive discomfort. We started thinking, well, that's unusual.
Yeah.
And then there was the health visitor.
I took Arlo to the health visitor. So Arlo was 3, I think, actually. We took Arlo, and the health visitor, I mean, thank goodness, some of the professionals are incredible.
Yeah.
You just get that magical person that takes one look at your child and says, I've seen this. That level of experience, and this health visitor was amazing, took one look at Arlo and said, I think your child might be autistic. Do you mind if I put your child forward for an assessment?
Right.
So actually it was really simple.
Quick, yeah.
Really simple, really quick. Not the same for Thailand, not the same for most children. But I think the way that Arlo presents, a little bit more extreme, and also has ADHD.
Right.
So I think if you're autistic and you've got ADHD, that's quite a combination. You know, your ADHD brain is writing checks that your ASD brain can't cash all day long.
It's a bit of a conflict. I mean, if you think about the stereotypical ADHD traits, sometimes very high energy and, you know, in many cases, very social, that's a contrast with some of the common stereotypical autistic traits. So,
Absolutely. Yeah. So you get these things that are almost in conflict.
Yeah.
Where you've got a child who's perpetually active and then perpetually exhausted. Because
it's like total cognitive dissonance.
Absolutely. Complete cognitive dissonance. The other thing with Arlo that was brilliant is that Arlo, another hint, was Arlo would refer to themselves in the third person.
Right.
Like tug you and go, she's thirsty.
That's
referring
really
to
interesting.
themselves.
I think it's, you know, more and more we're understanding. It would be ridiculous for us to say we know everything about autism or neurodivergent tendencies, because we don't. That depends on how much we understand about the brain, and we know very little about the brain. But we do know that people who are neurodivergent have literally a different structure in their brain. Anatomy is different. Some of the different parts of the brain might have larger or smaller volumes, and the sort of neuron connections might be different. So this naturally leads to autistic people, you know, perceiving the world in a completely different way. And we're not accommodating for that. We're thinking it's just a psychological...
We think of it as less than.
Yeah.
Rather than different. You know, what's to say in another 30 years there won't be more and more autistic people or neurodivergent people, and actually neurotypicals have to get assessed for neurotypicalness. You know? How about
You're
that?
not special enough to be,
I do think one of the things that's been a positive and is being a positive in it's negative in that it affects people, but it's positive in the response that has been. So many young people now are experiencing mental health challenges, the same kind of challenges that autistic people experience daily because of the number of stimuli that you've both been discussing. As soon as something begins to hit the mainstream, affect the mainstream to the detriment of the mainstream, it suddenly becomes a mainstream issue. Yeah. So what we're finding, and I'm sure that what you're finding in your profession, is that what has been considered to be exclusively excluded to the margins is now becoming more central. People are now beginning to look and say, what can we do? What adjustments do we need to make sure that the 1 in 6 kids who aren't in school anymore can come back to school? Well, here in the neurodivergent community, we've been saying for years, what can you do to get our kids back to school? And the answer has been nothing or very little. Now it's suddenly on the agenda. So this conversation is now beginning to become something that people whose families don't have autism in them, people whose families don't have what can be classified or was previously classified as neurodivergence in, are now beginning to be affected by. The things that we're discussing here now are beginning to touch everybody.
So when your autistic children, you know, when they were younger maybe, or even now, if they had a meltdown or some sort of really difficult episode they were trying to get through, or a tantrum when they were younger, what would you do to sort of calm them down and kind of get them out of that phase?
So the difference between a meltdown and a tantrum is an hour and a half.
Wow.
So tantrum is what all kids have, you know, but I want the lolly. I want the lolly. You know, I'm going to die without the lolly. And you just go, you're not having the lolly. And that's, after 5 minutes, they realize you're not going to give in, and that's it. But a meltdown, an autistic meltdown, is something else. It's the build-up of absolute intolerance around everything that's going on around them, and the anxiety is so overwhelming that they cannot cope with life.
Wow.
And when a child is in that space, I think the first thing that we learned was this is not the time to try and teach them a lesson. So So that's the first thing. You need to get up off the ground. You know what you need to do? You need to include yourself more at school and get yourself a friend. There's no point in saying they're not going to learn anything because they can't hear anything.
Somebody's having a meltdown, it's not a coaching opportunity.
It's not a coaching opportunity. Secondly, we cannot solve their problem.
Yeah.
As parents, the first thing we want to do as parents is, I want to solve your problem. Here's the solution. I've got it here, right here. It's going to work for you. They don't want to know that. They're completely dysregulated. The third thing is that if we get dysregulated, then you have two people dysregulated. You have the child and yourself. The better thing is to de-escalate in whatever way you can, whether that is, would you like me to leave the room? Do you want me to sit by you? What would you like me to do? And then repeat whatever they say. So if they say, I hate school, you're like, you hate school. I'm hearing what you're telling me. No one likes me there. It's awful. No one likes you there. It's awful. I'm hearing you. So to really hear what they say, repeating back what they say until they're in a space where they're calm. If they say, I want you to just F off, then you go, okay, I'm going to leave the room now. If you want me to come back in, I'll come back in. I'm just going to be outside. So you may think, what? They just said that to their parent? But actually, that moment, all you're trying to do is de-escalate. Then, once that child is calm, maybe a couple of hours after or even the next day, you go back and you strike while the iron's cold.
Okay.
So you go back to that situation, you say, okay, how are you? Where are you at today? What's happening for you? What happened yesterday? How do we improve on how we respond to you? What might you need to change? One thing that was a bit tricky for me was just swearing at me. So there will probably all our children will go, I'm really sorry. I'm so sorry. I dropped the F-bomb at you, Mum. I'm really, you talk about a 17-year-old. But it could happen with a 5-year-old just as easily. And actually just unpicking a little bit of that.
And when they have these behaviors sometimes, which could be challenging for, a mainstream school, for example, and their peers, their friends, did they encounter much bullying when they were growing up?
All of them.
They all
Every
did.
single neurodivergent person you will meet, I guarantee will have experienced bullying.
How do you deal with that as a parent to sort of, untangle them from that situation and actually minimize bullying as they're growing older? How do you deal with that?
Well, I think so much of the emphasis and the onus is on the person to change, when actually it's the world that needs to change. It's school that needs to change. It's the environment and the stuff we were talking about earlier about mindset. When those things change, our children have an easier time at school. So I think that's where we need to, I feel like in a way we're raising our children to prepare them for a world that is going to be tough. But on the other hand, we're trying to tell the world, please, can you help us with our children? Because their experience of life right now is not so good.
Every neurodivergent parent, or every parent of neurodivergent children, has to be a bridge. We're bridges. You have to be a bridge between the world that your children occupy and the world that they're trying to interface with. And you have to also be an interpreter to the world of who your children are. It's almost like being bilingual.
Yeah.
And, when Carrie was talking about listening, one of the skills that I've learned that I didn't grow up with that has become vital is I grew up in an environment, Jamaican families, man, we just like to argue. And I don't mean argue row. I mean, you could just like, no, I think this is right. And you get that kind of intellectual back and forth and back and forth. So I grew up listening to respond. With the kids that we have, I've had to learn to listen to understand. Because sometimes they don't want a response. So what you're doing is you're having to interpret to a world that listens to respond and try and teach them to listen to understand. Our kids don't necessarily need a response. They don't need an answer. They need to be heard.
Interestingly, I mean, when I was growing up, my parents, my mum's a doctor, my dad's a lawyer, and, very kind of traditional jobs, as it were. Structured jobs. And, I'm, my parents are relatively conservative, coming from a Indian culture and background. It was all about studies, high performance, high achievements. If I got 95, they'd be like, why didn't you get 98 kind of thing, But also, a loving home. I got everything I wanted, only child, etc. But I always felt that in Asian communities and many of these cultures where mental health, these other maybe neurodivergent conditions wouldn't be appreciated or acknowledged. But I feel in a lot of these cultures, and maybe it's the reason why historically a lot of these minority groups would not be diagnosed with ADHD, with autism, with,
Which is an issue.
because of that maybe cultural mindset where it's not acknowledged. And it's maybe just, oh no, he's like that because whatever, he's just born like that. Not because actually, is he autistic or,
Do you know, it's so interesting you say that. We were speaking the other day, doing a program with an African presenter. Well, he was a guest actually, and he's a well-known comedian, and he was saying that in Nigeria, he was originally assessed, and the assessment started with, it was his head teacher who would ask for the assessment and said, "We want to know whether you are neurodivergent or whether you are just stupid." And I think that for a lot of cultures, neurodivergence is considered to be it's another thing.
a weakness or something?
It's another thing.
Yeah.
It's like we're the wrong color in this society, so you have to fit in. We're from the wrong place, so you have to fit in. You are considered less than, so you have to be better than to be perceived as equal to. Please don't tell me you're neurodivergent as well.
If you look
It's
at
another thing.
If you look at the stats, maybe, okay, more than 1 in 100 people, with autism or on the autism spectrum disorder, right? And that's increasing now because we've got better diagnostic criteria and more awareness, but it was probably the same, 20, 30, 40 years ago.
Absolutely.
Growing up, and all my, extended family in India, surely with those kind of stats, some of them would have been neurodivergent, but it was never acknowledged. I don't know a single person in my family who has a diagnosis of any mental health condition or any neurodivergent traits or any conditions, which is outstanding because that cannot be true.
It's impossible.
It's impossible.
Yes.
So that itself is a sort of an illustration of how it's either disregarded or covered up.
It's also the need to fit in.
Yeah.
I think there is a deep need to fit in any immigrant culture, whether that's Jewish, Jamaican, Asian.
Yeah.
There is the thing, you have to fit, and 95 is not good enough. You need to get 98.
Yeah.
That's in all immigrant culture. We have to do better than what normal is.
Yeah.
It's the normal thing
To
again.
be accepted, you need to be above and beyond.
You need to be above and beyond.
Yeah.
So any setbacks are gonna be felt hard.
Yeah.
And that's the thing. And that's what we need to change. I really hate the fact that there are communities that are considered by certainly health and social care as being hard to reach. I hate this. I hate that phrase, hard to reach. Why are they hard to reach? It's not hard to reach.
We're not doing the right
They're sitting
things.
there. They're just like, they're sitting there waiting to be talked to.
Well, even if you look at the medical professions as a whole, in terms of how we deal with neurodivergency and autism, the DSM criteria, which is based on the American Psychiatric Association, they don't acknowledge these stims, the self-stimulating behavior.
Yes.
They don't acknowledge that as a useful thing. But if you talk to autistic people, and I've seen on social media, people talk a lot about these stims, hand waving or doing certain repetitive behaviors. It's a calming coping mechanism.
Absolutely.
So why aren't the medical professionals who are in charge of dealing with autism recognizing that?
Yeah, I mean, stimming is a really interesting thing. That can be such a calming influence. So stimming might be just walking up and down.
Yeah.
It might be big actions like that, big motor skill actions, but it could also be, I'm sitting here picking my finger. It could be like a small thing that you do the whole time that is actually keeping you calm or keeping you focused. Neurodivergent people generally do those things a lot more. So there'll be the lip biters, the nail biters, the hand biters, fidgets, the fidgety people.
I think also,
the drummers as well, the people that...
Okay, yeah.
Those
I was
people
that
at school
kid at
that
school.
drive you nuts. Yeah.
Now, at about the age of 4, they'd have said that kid has ADHD. Then they just say, stop fidgeting.
Yeah.
So I'd stay completely still and my legs would be going. It's just, I think that part of the part of the issue with what the question you just asked, and part of the answer is in much the same way as they say history is written by the winners. The diagnostic criteria is often written, well, almost always written by people who don't have a diagnosis. And, flapping my arms does nothing for me. Therefore, how can it be helpful for anybody?
Yeah.
Well, you're not autistic. If you were, you would know it were helpful. Why not? Why not? Just have a conversation with a focus group of autistic people and discover whether it's helpful.
Do you find that social media and the role it plays in raising awareness of ADHD, autism, and all of these various, neurodivergent conditions, is the benefit of that raised awareness greater than the risks of misinformation and people almost romanticizing these conditions as like, hey, I'm ADHD, I've got no attention, and kind of, almost using the stereotype as the main form, almost like the Rain Man, kind of glorifying certain aspects of it to say, I'm neurodivergent, and maybe they're not. They're just trying to gain views or likes or things like that. So is the benefit of those awareness better than all of those risks?
I think that any awareness raising is great. I mean, it's not my job to question someone's motivation. If they get something out of it for being like, that's their thing. But if they're saying something helpful, and I would say there's 100 times more helpful stuff out there than there is negative stuff.
Yeah.
It's not like people are going to start some theory of, it's not dangerous in that way. If you're just raising awareness, you're simply talking about yourself and your traits. And that I think is so helpful. There will be people that have listened today that will think, oh my gosh, my child does that. My child's doing 2 or 3 of the things that they've just mentioned. Maybe I should stop telling them off, and maybe I should think maybe this is something else that's going on for them. Or why am I always that parent that gets called up at the end of the day by the teacher because my child's done something? Behavioural challenges. Behaviour is communication. So, absolutely. Anything that raises awareness. Thank you so much for having us
and also,
on this.
Also, some people are very reluctant to sort of get a diagnosis or get their child diagnosed because they're worried about labels. It's only a label if you're worried about the label.
The label's only a problem.
Label's only a problem.
If you've got a problem with a label, we don't have a problem with a label.
For us and for most families that I know who had their children diagnosed, it's been an explanation.
Yeah, our children are fabulously autistic.
They're fabulously autistic. They are who they are. And I think the problems arise when we have a structured, rigid understanding of what normal and acceptable is, rather than starting a quest, a journey to discover who this child is, and then enabling them to fully become everything they're capable of becoming, regardless of the description.
I've already in, this brief time we've been speaking, as a reflection of your colorful personalities, you painted a really colorful picture of living life with autistic children and sort of navigating that sometimes very difficult landscape. So thank you both for coming on and just being so open about everything. Now, before I let you guys go, you had some questions. I have no idea what they are, so go ahead.
So I have spent many years talking about owning your own health. I've got Crohn's disease, and I feel like everything I learned through my Crohn's, I've also been able to use with our children or their differences. So shared decision making is a really important part of the healthcare service. How surgeons, how doctors, GPs, nurses speak to the patient. And how do we create better equality in our shared decision making? We know that, for instance, the literacy age out there, just general literacy in the UK is age 9.
Yeah.
So when you talk about health literacy and us being able to own our health and get better at doing our health and actually learn how to cope with long-term conditions, which many of us have these days.
So there's actually, it's a really good question. And one of the main overarching reasons I do what I do on social media is actually to improve public health by raising the level of health literacy. So, not using jargon, using layman's terms to describe quite complex topics. You have that, that paradigm where if you truly know something, you'll be able to explain it to a 5-year-old. While I'm not explaining something to a 5-year-old, I want to, have it in very basic terms that someone can understand, decentralize health knowledge in a way. And that is the role of my social media. And I would say being on social media, interacting and giving information in layman's terms has vastly improved my clinical patient communication. And, we have to not disregard the fact that the patient is the expert of their own life experience. So when they come to the table to have a discussion about their gallstones or their flare-up of inflammatory bowel disease, we're sitting at an equal table where I want to give them all my knowledge in simple terms so they can come to the table and we can have an equal discussion rather than a doctor-centric or a healthcare professional-centric relationship where we say, we're going to do this, this is the option, this is what's going to happen. So you have to acknowledge the patient's expertise in their own body and their own life and almost have that equal discussion where you seek to do what they want to do and you've armed them with all the knowledge. So I think that is the role of my social media, but also, yes, as healthcare professionals, not be didactic and, give a monologue of information and expect them to be satisfied with that. It's the end of the day, it's the patient decision, as we all know. It's patient autonomy.
And now we've got these new integrated care systems all over England. Are those new systems going to have you seen any improvements in shared decision making? Is it getting better, or are we just talking about it but not really when it comes down to it? We're all working on a crisis mode.
Yeah,
a lot of conversations don't happen.
A lot of things in healthcare take a very long time to roll out and to reach everyone. So there's a lot of, inequality in that, but also inequality in, we're still using printed patient information leaflets, and some people might be more digitally literate and they might want that. So they might only speak, Swahili or, Bengali, and we're not catering for that.
Yeah.
Someone might be rocket scientist level knowledge in Bengali, but might be a 3-year-old level of English. But we're treating them as a 3-year-old because they can't speak English. So there's a lot of, inefficiencies and inequalities in healthcare because, there's so many people pulling in different directions. And I don't think it will change very quickly, but there is change being made. And I personally think, for all its downsides, there is a huge upside of social media and the stuff I do. I've had patients recognize me now, and they come to my clinic and say, I've learned all about hemorrhoids and, diverticular disease from your videos, and they've come on with the knowledge. And I'm like, that is actually fantastic. You know more than, I did as a medical student now.
Karan, I love you. You are my new favourite person.
Brilliant.
I love that you know about hemorrhoids and diverticulitis. Okay. That's great. You've ticked every box for me.
Thank you again so much, guys, for coming on.
Thanks for having us.
Thank you.
Well, thank you to David and Carrie Grant for their very interesting insights into parenting 3 kids with autism. Now, autism is one of those conditions where we're still learning a lot about it. So naturally, there's going to be lots of pseudoscience, lots of myths, and lots of plain nonsense. And that is the point of this segment. If it ducks like a quack, I'm going to debunk some of those ridiculous myths you hear. And this episode, I'm going to be talking about autism myths. Vaccines cause autism. That is one of the biggest, most pervasive myths that we've seen about autism. And it's all thanks to one absolute idiot who lost his license as a doctor called Andrew Wakefield. In 1998, he published a paper where he linked autism to the MMR vaccine. And this was published in a pretty high-impact journal, The Lancet. And naturally, this caused shockwaves in the medical community. And since then, we've seen lots of controversy and lots of hesitance for many parents across the world in giving the MMR vaccine to their children. Now, the reason this is a ridiculous myth is the paper that Andrew Wakefield published was completely fabricated. And later, almost, 10 years later, that paper was retracted from The Lancet because it was complete nonsense. The safety of the MMR vaccine has been studied time and time again in very, very large studies, in meta-analyses where they've grouped together all of these studies and looked at the data, and there is absolutely no link between any of the components of the MMR vaccine and autism. And when a child doesn't receive the MMR vaccine, they're at higher risk of these childhood infections, which could leave them, struggling with development in their life. Autism can be cured. Now, I'd be lying if I told you that we knew all the causes of autism. We don't, and that's something that we are learning bit by bit. There is a genetic component, and increasingly there's an understanding that there's environmental factors as well at play. But using the word cure is slightly derogatory in terms of the language we use, because if you speak to a lot of autistic people and families, they like that part of their life and they integrate it into their daily lives, and it's part of their identity and personality as, someone with autism. Autism is a complex condition, which, as I said, we're learning more about. So it's not about a cure, but finding how society can adapt to autistic people and strategies to give autistic people so, they're not so affected by the societal restrictions that we place on people with neurodivergent conditions. Just before we go, we've got a listener question in Crowd Science. This week, we've got a question from Khadija in Portugal. When you have a bout of diarrhea, how can you tell if it was caused by something you ate? Now, when it comes to, the bugs which cause diarrhea and vomiting, it depends on the type of bug because they have different incubation periods, which means they can be dormant for several hours or sometimes even several days, and that can be much shorter, within a few minutes as well. So, for example, if it's a particularly pathogenic, virulent strain, you may experience a bout of diarrhea within, a few hours after eating some contaminated meat. So you've eaten a takeaway burger and it's got E. coli or something like that inside it. It's particularly pathogenic and virulent, and it can, immediately go infect your intestinal lining, replicate, and cause inflammation and diarrhea, pretty rapidly. There may be other bugs which lie dormant for maybe 24 hours or 48 hours and then start to replicate and then cause their symptoms a couple of days later. It's difficult to tell whether it was specifically the food that you ate which caused the diarrhea in many cases, because there may be coincidence. There may be other causes for your diarrhea. Maybe you're on antibiotics. So it's difficult sometimes to tease apart coincidence, and it may just be correlation. But another common indicator that you may have eaten something which caused diarrhea is if other people who have eaten the same food also experience diarrhea in a similar window, in a similar time frame to you, then you can identify that food has probably caused the culprit for your diarrhea because other people are affected as well. Common strategies, if you think it is a viral illness, in most cases it is a viral illness that causes gastroenteritis, if you're sure it is that, then taking medication to stop the diarrhea is not always good because you want the virus to essentially empty from your gut. Now, one of the most important things to do when you have diarrhea, you don't always need to go to the hospital unless you're unable to tolerate food or fluids and you're vomiting so much that you're dehydrated, then you may need to go to the hospital for rehydration. But otherwise, it's just bed rest, being at home, staying hydrated, using oral rehydration solutions, which you can buy over the counter. Basically lots of drinks that have salt and sugar content, not just pure water, because that will continue just to go through you and probably worsen your dehydration. Khadija, that was a great question. Hopefully my answer will help you and other people listening as well. And we've got another question, this time from Elijah. It's quite a strange question. Sometimes, not very often, maybe twice a year or so, when I ejaculate, my jaw, the bottom corners, and tonsils hurt, like an aching, overstretching, a cramp. Do you know why this happens? I told you it was going to be unusual, but on this podcast, anything and everything goes. So, Elijah, and if you and everyone else wants to hear the answer to this very strange question, you can listen to this and my deep dive and explanation to a bunch of other questions on Crowd Science Extra. You just need to subscribe to the Referral Plus. If you do subscribe to the Referral Plus, you get access to Crowd Science Extra and ad-free listening of all the episodes so far. Just visit the Referral Show page on Apple Podcasts, and right at the top, you can hit the Try Free button to start your free trial today. You'll then unlock the extra episode, which sits right next to this one on the feed. And don't forget, if you've got a question you desperately want me to answer, you can get in touch at thereferralpod.com. And that is a wrap on this podcast. Make sure you subscribe for weekly episodes and hit the notification bell so you don't miss out on that juicy science goodness. I'll see you next time.